Hi, my name is Naeema Cardona. I'm currently a freshman here at Texas State University, and this is my interview for the St. David School of Nursing. To answer the first question, why did I choose this program and how have I prepared for it? The reason that I chose this program was because when I was in high school, I was completing my pre-nursing associate's degree through Temple College's Texas Bio-Institute program, and everyone started to recommend that I look into this program. So that's what I went ahead and did, and I learned about their 100% NCLEX passing rate. I learned that they're one of the top ranked nursing programs in the state of Texas, and I also learned that they really value making nurses who cater and appreciate their patients, which is something that I strive to have when I am a future nurse. Another thing that I really liked about the program is the amount of diversity and the amount of hands-on learning experiences this program gives through clinicals and through sim labs. The way that I've prepared for this program, again, like I said, I finished most of my prerequisites in high school. I just finished them up this past semester, and I took the TEAS exam, and I have done multiple types of volunteering, which has strengthened my softer skills. Doing all of this the past few years has really strengthened my critical thinking skills, has really taught me how to manage my time and how to deal with the heavy workload, which is something that I'm going to need to know to do well in this type of rigorous program. So to summarize all of this, this has really given me a strong foundation to be successful in this nursing school. To answer the next question, what is an experience that has prepared me to care for a diverse population of people? So my dad is suffering from non-Hodgkin's lymphoma, so I try to go to as many treatments as I can with him. Sitting through all of these treatments with him, I've really seen the diversity in people. I've seen people that are older, and I've seen little kids and people from many different ethnicities. And one thing that I've really noticed is how these nurses treat these patients. They treat these patients with such kindness, and they realize that everyone is different and everyone has different needs and how they adapt to those needs. And that's very inspiring to me and something that I try to apply in my current volunteering. To answer the third question, what are some volunteer work or life experiences that have prepared me for a career in healthcare? So to start off, I've done Brazilian Jiu-Jitsu for most of my life, so this has definitely given me a lot of discipline. And throughout these years, I have coached little kids. I've coached kids from little 4-year-old babies all the way up to 15, 16-year-old teenagers, and that has definitely taught me really good communication skills and leadership skills. It has also taught me how to communicate well with children. The next volunteering that I've had was at the Temple College Texas Bio-Institute program, and here I participated in a lot of the open houses. So during these open houses, prospective students would come with their families. I would give them a tour of the campus, and I would tell them about my personal experience in the program. And I did this to make sure that they really understood what the program was. I tried to break it down into simple terms and to help them feel more comfortable and less intimidated going into this program. And I can apply this in the healthcare field with my patients by making sure that they're comfortable and they're not nervous for being in the hospital or going into the doctor's office for whatever procedure or reason that they might be there. The next volunteering that I've done was at St. David's North Austin Medical Center. So I was a volunteer floater, and I also worked in tea time. So as a floater, I did a lot. I was really exposed to a diverse population of people. I got to work with patients of all different ages, and that was super fun. So when I was stationed in the front desk, I would take these patients to wherever they needed, whether it be go visit a family member, go to their appointment, or get them prepared for ambulatory surgery. Another thing that I did often was I would get paged to different units around the hospital and help them with whatever they needed that day. I used to work a lot with radiology in the emergency department, and this really showed me how important teamwork is and how often the different units in the hospital really collaborate, because I would go running around back and forth. And this showed me that you need to have a really strong team to give the patient good care so they have a really good experience at the hospital. The next type of volunteering I've done was tea time, again at St. David's North Austin. And here I was in postpartum and labor and delivery. I was bringing teas and cookies to the moms there. And this really showed me that a small gesture can really go a long way. So when I'm a nurse, I really want to do my best to help make the patient's day better, especially if they're in the hospital, because they're probably not having the best day, they're probably not going through the best time in their life. This has also really taught me how to read the room. For example, do I go into the room, talk to the patient, give them the tea and the pastries, or should I leave and come back later and let the patient have their space? The next type of volunteering that I've done and that I'm currently doing is at Baylor Scott and White in Round Rock. I'm a postpartum volunteer, and here I work very closely with the nurses. I help them with whatever they need, and some of the few things that I do is answer the patient call lights, I stock supplies, and one of the really important things that I do there is maintain safety in the unit. So I'm in charge of who comes in and out of the unit. And again, this shows me how important teamwork is, because I'm always talking with the nurses to make sure who is and who is not allowed in the unit depending on what patients we have that day. And it has also taught me how important situational awareness is while working in the hospital, because again, you do not want any unwanted visitors or any dangerous situations occurring in your unit or in the hospital. To answer the last question, knowing the barriers that technology can impose on conversations, how do I plan to overcome that while talking to my patients? So first, I want to acknowledge that technology can really be intimidating, especially technology in the hospital. The patients are probably not familiar with that. So I want to make sure that I can explain to them what I'm doing and why I'm doing it. So if I'm charting in their electronic health record, I want to tell them what's going on. The next thing that I want to do is shift my focus on them. So I want to stop my charting, and I want to make sure that they know that they have my 100% undivided attention. I want to make sure that I maintain eye contact, because not only is that going to reassure them that I'm paying attention, it's also going to help me read their body language, and that's something really important to me when it comes to communication. Then once I finish listening and interacting with the patient is when I will finish my charting. So this is my interview. Thank you so much for listening, and I would be honored to be a part of this program. Thank you.